proving of Hahnemann, proving of the old masters. And I tend to combine the old proving with the modern mathematica as well. And here is a short presentation of calcarea phos. Many times I also use calcarea phos as in a calcarea constitution phosphorus symptom or vice versa. But calcarea phos in itself has wonderful symptomatology. So let me take you through a pictorial presentation of calcarea phos. This is the appearance of calcarea. I give a lot of emphasis on look and diagnose. How the patient appears before you, how he walks, how he talks, how he speaks to you, his attitude, etc. So we have a tall, thin person. Sometimes we call it a lanky constitution, flat chest, and which you can see over here, especially in the growing years. Here we have the gait, which is a staggering gait of calc phos. When the patient walks in your consulting room, I always watch how he's walking in, and that's important. Here is the nail. If you look in my miasm presentation, I mentioned glossy nails are tubercular. In my book, I give a lot of emphasis on that. And your calcarea phos is a tubercular miasm. So you have glossy nails and you have spots on the nails, and that's calcarea phos, which is a tubercular nail. Here is a sleep position in a baby, which we call a genupectoral position, knees and face forced into the pillow. So many times I ask the parent how the baby sleeps, and many times that gives an unadulterated picture of the medicine. Here in calcarea phos, one of the weakest link, I give a lot of emphasis where the chain breaks. I generally put 3 areas as the weakest link in the medicine, and in calcarea phos, tooth is one of the weakest area, abdomen is one of the weakest area, mind is one of the weakest area. Schussler makes it is one of our preeminently teething medicine, and you could see there are various type of teething problems in calc phos. We have the delayed milestones because of the calcium and phosphate deficiency. So as a consequence of the delayed milestones, you have the sutures open, and especially the posterior fontanalis. But in these days, we find the emaciated constitution, delayed milestones, especially delayed teething, and that's important in calcarea phos. You could see the tooth decay as soon as they appear, and that's important for calcarea phos. I have here the anemic children, thumb sucking. So once again, look and diagnose. Sucking the thumb always wants to